Hi everyone. If you already read the introduction letter, you already know a little bit about the project. I just want to say I'm sorry that we couldn't see each other this year. I hope that you do stop in next year and say hello and that you have a nice summer. Um, the COVID-19 infection fatality rate project that you are going to work on, I'm going to explain a little bit of background and how I came up with the project. I was actually really excited. We were doing scatter plots and functions because we can use something in real life to do the math right now. That's the most common thing that you ask me is how am I ever going to use this? And this is something that you may use in life, these scatter plots, or you may have to read them, or you'll at the very least see them in the news. So hopefully you can read them critically and understand what they mean. One of the graphs in the news that we had a lot of when we were shut down was the flat and the curve. So that's an example of a graph that they used in the media constantly. You'll even notice they had time since first case. So they had an x axis, they had a y axis, number of cases, and then there were two separate graphs. So the first one was the number of cases across time without protective measures, and the second one was the number of cases over time with protective measures. So you'll notice without protective measures, they're saying at this time, okay, the peak would be over, but there would be so many more people at the peak. Whereas when we have a longer period of time, since we were doing the shutdown and social distancing, the peak is much lower and it actually spaces it out over a longer period of time. So obviously it's not going to go away, but the point of this graph was to show you that the healthcare system, this dotted line is the capacity or how many hospital rooms are in the United States, and they didn't want to go over that so that people that were sick were able to get treatment. So you see this in the news all the time. Now, this isn't linear, but it is a graph of a function. The data that we're going to use is going to be a linear function. So linear meaning it will make a line. So your data will make a line. Okay. COVID-19, just real quick, if you haven't seen this already, CO stands for corona, VI virus, D disease, and the 19 is for 2019 since that's when they found it. So it's coronavirus disease 2019. Okay, what is the infection fatality rate? It's also called the case fatality rate. So you'll see the two words interchanged for each other and they mean the same thing. The formal definition is the proportion of people who die from a specified disease among all individuals diagnosed with the disease over a certain period of time. So I know that's just the definition of it, and I wanted to explain it to you with a couple examples. If the infection fatality rate is 1%, okay, so we know that a percent is out of 100, so that would be 1 out of 100. One person dies per 100 people infected. Okay, so if there were 100 people that had that disease, one of them will die. And of course, there's always exceptions to everything, but that's with statistics, they want to know approximately what would happen. The flu has an infection fatality rate of 0.1%. So 0.1 person dies per 100 people infected, which doesn't make a whole lot of sense yet, but if I multiply the zero point 0.1 and the 100 by 10, both of them, 0.1 times 10 is 1, 100 times 10 is 1,000. I can do that because then they're still going to be in the same ratio. That means one person dies per 1,000 people infected. So with the flu, if 1,000 people get sick and have the disease, most likely one of them will die. Okay? So let's talk about infection fatality rate during a pandemic because that's a little bit different. The flu's been around for many years. There's tons of data. They have years and years of data. Whereas for the coronavirus, there hasn't been a lot of data. The data that I'm going to use for the United States goes from January 21st, 2020 to June 1st, 2020. So that's not a lot of data when you're looking at things and trying to find patterns. A couple things you have to consider with infection fatality rate is testing. We had criteria to be tested. Okay, so everybody at the beginning that was tested was very sick. They were hospitalized or they were exposed to somebody that was very sick. Our criteria is expanding. We are starting to test healthcare workers and other people, but at the same time, you have these mild and asymptomatic, meaning they don't show any symptoms at all. These illnesses that are probably not being counted as infections, because if you just think you have a cold or you're not showing any symptoms at all, why would you get tested for coronavirus? So that's one of the things we have to consider is the infection fatality rate. When we talk about infections, we're only talking about the really sick people right now that have been in the hospital. So that's why, if you read the article, the antibody testing is important for the statistics, because the antibody testing will actually tell you not only the people that have been severely infected, but the people that were mildly infected and didn't show any symptoms. So you can get a really good idea of how many people have been infected. Then you know how many people have died, and you can find out what your chances of death are if you get coronavirus. Okay? The data that we're going to use is from New York Times and Johns Hopkins University. I downloaded it from this site, but I already broke it up into separate spreadsheets for you to use. Like I said, my example is going to be the entire United States, so I have a lot of data in my spreadsheet. I broke yours down by counties, so you will each be assigned a county in New York. I picked 10 counties out of the state, and you will have one county of data that you will have a spreadsheet for, and you are going to figure out what is the infection fatality rate for that county. So these are the 10 counties that we're going to use. You will be assigned a county. It's already on Google Classroom, and find that infection fatality rate. Okay, so here are the next steps, and they're listed in your project document. You should have already read the introduction letter. If you haven't, go back and read it. You should read the article from NPR if you have not already. Okay, and that's about antibody testing and infection fatality rate. You're watching the COVID-19 introduction video. After this, you're going to watch the COVID-19 creating the Google spreadsheet video, and I'm going to show you exactly how to create the scatter plot, and also how to create the line of best fit, and how to find the equation of the line of best fit. Okay, so those last three sections that we did on scatter plots by hand, you are going to be doing them using Google spreadsheets. It's really quite easy to do. It doesn't take many steps at all, and you get the data is plotted on the graph, the line of best fit is drawn for you, and the equation is found. Okay, so those last three sections of the unit. Then that's creating your Google spreadsheet. So you're going to download your data. There's a link under the instructions under the project document. Okay, and then you can watch the video and pause and follow along as I do it, or you can read the step-by-step instructions. After that, you're going to watch the COVID-19 open response questions video. I put a question mark there. I would suggest that you watch it, but if you would like to answer the questions on your own first, that's fine, and then you can go back to the video and see if you answered them correctly. The the questions are about using your scatter plot and using linear functions. So seeing if you can use the linear function to make predictions from the scatter plot. Okay? After you're all done with that, hopefully you will have learned something about using real life data and using scatter plots. Make sure you check your project with the rubric. The rubric is under the project document. Okay, make sure you did everything in there, because There is no more time left in the school year to be making any changes. Your project's due June 12th, which is Friday. Okay. 10 points will be deducted every day late. So if you turn it in Friday, it will be on time. Saturday, 1 day late. Sunday, 2 days late. And I won't accept anything after Sunday. Sunday is June 14th. You can't turn in anything after that because I have to put your grades in for the end of the year. Okay? When you go to turn in your project, make sure you have add your Google spreadsheet and chart. You'll have to add that actual data or your spreadsheet to the that, and just make sure that your open response questions are attached to the assignment. Um, they should be, but double check and make sure that your answers are in the document. Okay, so both pieces will be graded using the rubric, which um, you can look at, and that will be it. Then you'll be done for fourth marking period and the rest of the year. So please read the project early, watch the videos early, email me if you have questions. We can do Google Meets, okay? Because after Friday, there's not much time left to ask questions. All right? Okay, so when you're done with this, go back to the project page and then you can go on to creating the spreadsheet video.